today's world, go over the 6 pillars of lifestyle medicine, and then talk about how we can bring it into our lives, into our communities, and how we can actually implement it. So lifestyle medicine is a new medical specialty which uses evidence-based lifestyle therapeutic approaches to prevent, treat, and often even reverse chronic lifestyle-related diseases. Things that we heard in medical school as could not be reversed. You guys heard Dr. Brooke Goldner's talk about amazing things that she herself has gone through personally and helped other people reverse. And we see this in lifestyle medicine all the time. We see people reverse diabetes and heart disease and many things that are due to lifestyle initially. So American College of Lifestyle Medicine was actually formed in 2004 when CDC reported that over 80% of chronic diseases in today's world are related to diet and lifestyle. So it makes sense to try to address diet and lifestyle to prevent, manage, and even reverse many of these diseases. American Board of Lifestyle Medicine was formed in 2015 with the first board exam given in 2017. My husband and I got board certified in 2018. I think Dr. Riz, you were 2019, right? And then we created Lifestyle Docs Clinic in 2019, and it has been just so amazing to bring that into my practice of internal medicine. So the reason I like lifestyle medicine is because it's an evidence-based field. It focuses on educating and empowering the patient. So often I feel like I'm not just their physician, but I'm also their cheerleader and their health coach. Uses lifestyle as a therapeutic approach. I still am writing prescriptions for statins and diabetes medicines, but now I also give the option of using lifestyle as an approach, which is something that I really wasn't taught to do so much in medical school and didn't do for probably the first 20 years of my practice. And most importantly, I'm passionate about it is because it addresses the root cause of disease. So this slide, some of you have seen it already. I love because I feel like a lot of my medical practice initially, I was diligently mopping the floor. And I was teaching my patients how to mop the floor. And we were both diligently mopping the floor. But we weren't getting to the root cause of things. And lifestyle medicine allows me to help the patient walk over and turn off that faucet. And that has made such a difference. So we all know we're facing an epidemic of chronic diseases, obesity and overweight. Over 70% of Americans are obese or overweight. Heart disease has been the leading cause of death the last 105 years. Cancer and autoimmune diseases rates are rising, and diabetes has just skyrocketed. Here's a graph that shows how diabetes rose 8-fold in 50 years, and it's continuing to rise. In fact, 11.6% of Americans now have diabetes, and 1 in 3 have prediabetes or insulin resistance. So in just another decade, it's going to go up from 11% to 20-30%. And we're seeing the similar graphs, similar trends, for not just diabetes, but high blood pressure, heart disease, and other chronic diseases. So what are we doing about it? What are we doing about this rise in epidemic of chronic diseases? We're spending a lot of money, much more than any other first world country, to where 2023 per capita health expenditure was $15,000 per person. In 2023, 4.9 trillion was spent nationally on healthcare expenses. So we are spending money, we are doing that part, but it's not showing in terms of improvement in chronic diseases. And here's another marker to where the lifespan has started dipping down. And you guys heard Dr. Brooke Goldner talk about how this is going to be the first generation that doesn't live as long as their parents. So our kids and grandkids are not expected to live as long as us and our parents and grandparents because of the chronic disease epidemic. So what do you think? If money isn't working, technology isn't working, what should we be doing for chronic diseases? Diet and lifestyle, exactly. Yes, very good, Lynn. That is what works. So that's what we are here to talk about. These are the 6 pillars of lifestyle medicine. I love this little infographic on how everything fits in like a puzzle. Because you could have the best diet, but if you are not getting enough sleep, you're sitting on the couch all day long, you're getting all stressed up, your health is still going to suffer. It has to be all things. That's why I said holistic health and lifestyle medicine are basically the same thing to me. So we're going to talk about nutrition, exercise, stress management, avoidance of tobacco, limiting alcohol, sleep, and healthy community and healthy relationships. Okay, so let's start with nutrition. What the evidence shows is that we need to eat more plant foods, we need to limit our processed foods, and we need to limit our animal foods. Why eat predominantly whole food plant-based? And you guys heard lectures all day long from dermatologists and vascular surgeons and cardiologists, so you know that it helps with human health. And the reason it helps is that it provides us with superior micronutrients. We can get good quality protein, good quality carbs, and good quality fats with plant foods. It has a lot of antioxidants that are not just good for skin health, like the dermatologist talked about, but also in terms of prevention of diseases and anti-aging properties. Has phytonutrients that fight cancer, has vitamins and minerals, and epigenetics. This is a new field. It wasn't around when we were in medical school, but basically what we have found out is that your genes are not your destiny. So even if you, let's say, inherit the diabetes gene, if you eat healthy and practice lifestyle medicine, that gene doesn't have to be expressed. There are these little proteins on top of your DNA and genes that can turn those genes on and off. So healthy diet and lifestyle can turn on health-promoting genes and turn off disease-promoting genes. Microbiome, it turns out those little gut bacteria that are in, that take care of so many things, they love plant foods. They love fiber, they love resistant starch. So when we eat a lot of those, it helps them thrive in our gut. And then immune system, you heard about Dr. Goldner talk about how immune system is affected with our diet as well. So the next pillar is exercise. So as lifestyle medicine physicians, we recommend at least 150 minutes a week if you're trying to maintain your health and trying to maintain your weight. But if you're trying to lose weight or if you're trying to reverse diseases, then we'd like you to take it up to at least 300 minutes a week. After 420 minutes a week, it plateaus off and you don't continue to see benefit by increasing. So 300 minutes a week is great, but at least 150 minutes a week. And we know that physical fitness, cardiorespiratory fitness, is a direct link to longevity and health span, lifespan and health span. Exercise lowers our stress hormone. It's actually the most underutilized anxiolytic and most underutilized antidepressant there is. Also affects epigenetics, also helps turn on and turn off those genes, and improves our microbiome, which was a surprise to me, because I understand like being in nature, walking and hiking would improve your microbiome, but even if you're exercising indoors, it improves your microbiome. Stress management is another very important piece of the puzzle. Of course, it lowers stress hormones. It also affects epigenetics. It affects physical and emotional health in terms of published research in managing, reducing anxiety and depression with mindfulness practices such as yoga, tai chi, and meditation. is so copious. And I think I saw our Tai Chi teacher here, and we're so happy that this is the reason that this conference offers not just nutrition lectures, but also things like, oh, I see our Pilates teacher here as well. I think our yoga teacher had to leave a little early. But this is why all of it is very important, because the same exercises also work really well to help reduce stress. And then these days, there's so many different ways to add a mindfulness activity, right? So I recommend that my patients do at least 10 minutes of a mindfulness activity a day, every day. And they choose, you choose. It can be gardening, it can be listening to a musical, playing a musical instrument, or even listening to music counts. It can be meditation, it can be breathing exercises. And these days there's so many apps out there. I love my Calm app. There are patients who like Headspace, 10% Happier. Insight Timer is a free app. If you want to start playing with meditation apps. Also, a really good one is Healthy Minds. That is developed by a neuroscientist. Okay, sleep. Recently, a medical student who was rotating through our clinic doing a lifestyle medicine elective asked me, which is your favorite pillar of lifestyle medicine? And I tried to tell her, they all come together, it's a piece of a puzzle. She said, no, which is your favorite pillar? And my parents are here today, and they'll vouch that sleep is my favorite pillar of lifestyle medicine. And I have understood its benefits way before I even knew lifestyle medicine. It's always been a priority for me. And it's good that now there's all this data that shows that is where repair and detoxification occurs, is when you sleep at night. All through the day, we're coming across pollutants, carcinogens, our bodies actually, there's cancer cells happening, and our body kills them off in our sleep. So don't feel guilty about getting your sleep. That is super, super important. As lifestyle medicine doctors, we recommend 7 to 8 hours of sleep. Also improves your microbiome. Turns out the gut bacteria, they have a circadian rhythm too. So when you sleep at a good time, then that again helps them thrive. Lower stress hormone. If you're not getting enough sleep, you get cranky and anxious the next day. Really related to emotional wellness, and of course, cognitive processing. How many times have you heard before your job interview, before that big test, make sure you get good night's sleep? Because that is absolutely the best advice. Eliminating tobacco and limiting alcohol, I'm going to spend the least amount of time on this. Reason being, media has done a good job with this pillar of lifestyle medicine. All of us know that it increases your risk for cancer, heart disease, and other chronic diseases. One thing I will tell, because many people still don't know this new data, studies now show that for women, more than 3 drinks of alcohol a week does increase risk for breast cancer. So another reason to reduce that to below 3 drinks a week. And then the last pillar of lifestyle medicine, community. This one is one that, believe it or not, Dr. M and I need work on. I know it doesn't seem this way, but we are both introverts, and lifestyle medicine has kind of forced us to realize the importance of this. And so now we have monthly potlucks at the clinic, and now we do these retreats because you guys are our community. This is the only time in our life that we've actually found community. So we thank you all for being here for us. So there are studies that show isolation is a big health risk, to where they've done studies after a heart attack. It's not your cholesterol number or your blood pressure number that determines whether you'll be alive or dead a year after a heart attack. It's whether you feel isolation or not that determines the mortality rate more than anything else. healthy behaviors rub off. So there's so much data that when you hang around with other healthy people, you tend to get healthier. So you being at the retreat today and being with all us health nuts, it's good for you. And lastly, we can't talk about community and not talk about blue zones. Who here knows about blue zones? Oh, wow, this is a good crowd. So somebody tell me, what are blue zones?
Over 100 years, a lot of healthy people.
Absolutely. So I heard centenarians, a lot of centenarians, people living over 100, but they have not just, like somebody said, healthy. They have very low risk of cancer and heart disease. So they have long lifespan and long health span. So it turns out they're practicing lifestyle medicine without even knowing what lifestyle medicine is. They focus on community. They eat a lot of plant foods. They're not vegan or vegetarian. They don't know what those terms mean, but it turns out that like 80-85% of their calories are coming from plant foods. These are the areas of the world where people live really long, healthy lives. They don't have gym memberships, but movement is a definite part of their day. They take time to downshift. So yeah, if you guys haven't seen it, there is a Netflix documentary now called Living to 100. Yeah, it's on the blue zones. So I encourage you to check it out. So here is the summary. Whether you look to World Health Organization or American Institute of Cancer Research or American Academy of Nutrition and Dietetics or American College of Cardiology, they all say, as Americans, we need to increase our fruits and vegetables. We need to reduce our saturated fats. And the main sources of saturated fat in American diet is red meat and cheese. Cheese, that surprised me, is one of the big sources of saturated fat in our diet. Reduce added salt and sugar, and the main sources are processed foods for salt and sugar. So those packaged foods. And then we need to increase our physical activity. We need to maintain healthy body weight. All of those things kind of happen when you practice lifestyle medicine. So many of my patients are motivated to practice lifestyle medicine, but often it's hard. It's hard to implement it. And that's when oftentimes I have them get Dr. M's help. So if I could have him come up so he can tell us how to implement lifestyle medicine. Oh, yes.
Thank you so much. You guys have made it through the day. We're only going to keep you another 30 minutes before we let you out. But really want to thank all of you for being here. So Dr. B covered, I think pretty convincingly, that why it's important to practice lifestyle medicine. And here's the graphic again. And I think all of us know intuitively before you even came across this field to eat well, to sleep, to move, exercise. These all seem pretty good things to do. They're going to be good for our health. And we shared a lot of the data from throughout the speakers today. But many of my patients, they say, I know what to do, but I'm not doing it. So this is what I want to kind of spend time on, and maybe we can go from this end of the slide to I will do it, I can do it, and yes, I did it. So let's take a little journey. So when I started this, it was, we came across lifestyle medicine and said, okay, now we have the data, we just need to share this knowledge. Everyone's going to be just getting healthier. And the fact of the matter is a lot of people did, but a lot of people didn't. So that sent me on a personal journey, like what is the gap? Why are folks not implementing the habits, the tools, the research that they know? So I did a lot of research. I went into the field of neuroscience, behavioral psychology, read several books, took a coaching course, and I also learned from my patients. It's like, okay, what is missing? So kind of distilling all of that, I came up with this graphic. Don't worry, we're not going to go through this. And so this is sort of a simpler version of it. And this is what I like to call the 4 C's approach to lasting positive behavior change. So as you see here on the right side, we need to be clear, like what are we really after? And then making a commitment, and compassion, and then finally consistency. So we're going to focus today on commitment and compassion. So one of the part of being committed, having commitment is like, okay, I'm going to do things a little bit differently than I have been doing. If your fridge looks like the one on top with sodas, takeouts, these type of things, it's not going to lead to very good health results. So we want to make a commitment that I'm going to shop and prep differently. Maybe I'll add more tools, maybe learn how to cook, or take up a new hobby, or maybe even walk after work. Whatever works for you, just saying I'm going to do something different. And then, my engineers especially, they love to track. And this is actually very helpful. When you follow okay, if I do this, this happens. If I do A, I'm sleeping better. If I do B, maybe not so much. When you track things, if I'm eating a little bit differently, all those different things can help us move us into the right direction. But this is necessary to do, but this alone is usually not sufficient because we have some challenges. And one of the biggest challenge is our own physiology. And Adam Sudd, very eloquently talked about this, earlier today, about the pleasure trap. Of our own physiology, of our own brain, our nervous system loves sugar, fat, and salt, right? There's no way to, miss that. And processed food companies know this, right? They are trying to calculate the bliss point. What is the right ratio of the product? And they're pretty blatant about it. They'll say, bet you can't eat just one. I mean, that's the tagline for Pringles, right? So we have, challenges in front of us. The other challenge is just society as a whole, right? When you try to eat healthy and your friends and family say, oh, poor you, I see you're eating a salad. Oh, you're not eating this. You're skipping dessert again. Live a little, right? How many times have we heard that from our close friends and family? So the environment around us is not always conducive. And we all have such busy lifestyles, busy, day job, lots of family obligations, and that a lot of times leads to poor sleep habits because there's so much to do in the day. And now this is the newest epidemic, digital addiction. From 3-year-olds to 95-year-olds, I've seen folks just kind of hooked on their devices. And they do a lot for us, but they can be a source of significant downside to our health. And just, weight loss drugs, these have come about really in the last 5 to 7 years, really taken off, right? We can eat whatever we want, we'll just take a pill. I have heartburn, but I don't need to skip the wine or the steak or whatever, I'll just take a pill. So this has become just so prevalent. We're just looking to pills and procedures to, make us healthy, but ultimately they just weaken us. And it's just become sort of normalized that surgery is not something that's off the table for someone trying to lose weight. So these are the traps that society offers us, right? So this is something else we need to be vigilant of. So how can we move forward given this environment, given our own physiology, which loves these foods? So with that deeper understanding, we need compassion. Right? There are many times, and I see it in my patients, they're eating healthy, they're on the right track, and something happens, and they kind of backslide a little bit. And they feel really bad about that. They really have negative self-talk. They really are hard on themselves. And what that does is that makes us more stressed. It stresses the system. And what do we know from behavioral psychology? The more stressed you are, the harder it is to make a positive change. So me bringing up kind compassion, this is not me being nice to my patients. This is what the research shows, that you have to be kind to yourself. So these words that you see here, kind compassion and fierce compassion, this is not my terminology. This comes from the work of Kristen Neff, who is a pioneer in research on self-compassion. And this is how she sort of divides things up. So let's talk about kind compassion in a bit more detail. So let's say the plan was to eat an apple after lunch, but somehow you found yourself that you ended up having cookies. So at this time, we don't want to just ignore what happened. We want to acknowledge, okay, this is what I intended to do, but it didn't happen today. But at that time, if you can take this stance that, okay, I am imperfect like everybody else on this planet. When we mess up, we think we're the only ones messing up. We're really kind of hard on ourselves. But when we say, okay, I am imperfect like anyone else, I'm going to give myself a break. I'm going to be kind to myself. And also, being kind to myself, I know when I eat well, when I sleep well, when I do these healthy things, I know it's good for me. It's compassionate for me. So that's part of kind compassion. That's being willing to start again. Just because you had an off day or off meal doesn't mean we're going to throw everything out. We're going to be willing to start again. And that's really the main emphasis on fierce compassion, that I'm going to stick with it, right? I know at times my physiology is going to be a challenge. Society as a whole is often a challenge, but I'm going to stick with it. I'm going to work on my external environment. I'm going to shop differently. Maybe I'll do some prepping. And I'm also going to work on my internal environment. And this is something, Adam said, talked so eloquently about earlier in the day. So we're going to talk a little bit more about the internal environment and also focus on resilience. So then the question is, how can I work on the internal environment? And, some of the movies we just really love, this is, Oogway talking to Poe. He's really underlining the importance of being present. Okay, so when we hear about mindfulness, a lot of people kind of have a standard definition, paying attention to the present moment without judgment. And I've heard that, for dozens of years, but what does that really mean? What is that going to do for me? So I want to unpack that a little bit. So what we mean by paying attention to the present moment is we want to have conscious awareness of what is happening as it's happening, right? Oftentimes, we're not aware. So I'm really making a distinction about conscious awareness and subconscious awareness. So and I'm going to use these corollaries. They're not perfect, but they're very close. So we're going to say subconscious mind is synonymous to the brainstem. And what's the job of the brainstem? To keep us alive, right? It's monitoring our blood pH, oxygen, nutrition status. What do we need? Moment by moment. It's always running. It's on 24/7. Its job is to keep us healthy, keep us alive, away from harm. This is our survival brain. It's going to keep us alive. That's its job, and it's very good at doing that. It's on 24/7. Our conscious mind or cortical brain has that long-term outlook. Is that really the best decision for me? But we are not giving the full information that the subconscious mind or the brainstem has. It never filters up to our conscious mind. So when I'm saying we want to be consciously aware of what's happening in our body, this is what I mean. This is what mindfulness allows us to do. When we're feeling a little bit anxious, a little bit stressed, if we have that information early, maybe we can nip that urge to get the cookie in the bud, right? So we all know that we're all easily distractible, even though conscious mind, cortical brain is very good at long-term planning and all what's good for us, it's easily distractible, right? So when we can train our mind to be less distractible, we can have a skillful response. This is what mindfulness allows you to do. It lets you reduce your reactivity and allows you to be a bit more bit less distractible. So let's kind of put it in practice. So how is this going to work? All right, so I call this the PAL practice. The first thing to do is to just pause. We're all so busy doing. We get so easily distracted from this shiny thing, that shiny thing. So we want to just take several pauses in our day. And let's say if you pause and you realize, I'm getting a little stressed. And usually if this continues, I'm going to reach for that cookie or that piece of cake, right? If you can catch it really early, then maybe you have a chance of making a more skillful response. So when you pause, you can become aware of your internal state. You can become aware what is happening in my body in real time. And like the song says, if you become aware of the discomfort and then you can let it be, okay, I realize I'm stressed. I realize I'm feeling anxious, but I don't have to fix this right this second, right? This is what the subconscious mind, this is what the brainstem is habitually doing. It's saying, okay, you're stressed, let's get a cookie. So that becomes our habitual response. Now we're going to introduce these tools that we can make a skillful choice as opposed to a habitual choice. And the truth of the matter is, we do have a choice. This is a quote from Viktor Frankl. I'm guessing most of you know about him, the Holocaust survivor. Few of us are ever going to be faced with such horrific circumstances as Viktor Frankl. And he writes, between stimulus and response, there is a space. In that space is our power to choose. And in our response is our growth and our freedom. So everything that we're doing here today, we're going to do it together. We have the power. We need to do it together. And so reduce distractions, pause frequently, and training our mind. This is really what mindfulness can offer to us, that when we reach for that comfort food or reach for that glass of wine or smoking or gambling, whatever we might reach for to ease that ill feeling, that under lack of ease feeling, we can do something different. So this is what mindfulness training our mind offers. And another thing we can do is build resilience. So what do I mean by building resilience? And I just noticed that, I put all of these things here and maybe the slide got full. I forgot to add food. We can eat healthy foods. That's going to be a big part of building our resilience. We can try some breathing exercises. Maybe, as Dr. B mentioned, try an app for mindfulness. Yoga, Tai Chi, being in nature. For some folks, mindfulness is a little bit of a steeper climb, but we can all get out in nature. And there you don't need to do anything. You just let nature do the work. We just need to show up. For some of my patients, journaling or gratitude practice works well. And I think many folks have talked about the importance of sleep. This is just such an important pillar of lifestyle medicine that, I just really want to underline it again. If you want to be less reactive, be a nicer person, make better choices, whether emotionally or with food, sleep is just non-negotiable. This is just such an important thing. And community. And, just when we're around other people, like Dr. B mentioned, their health behaviors rub off on us. And it's easier to do it together. Isolation, as she mentioned, kills. So we want to do this together. This is such a wonderful way of moving forward together. And I just want to briefly point out that we've tried to include a lot of the activities you see on this slide here on this retreat. And this has been our effort or endeavor, ever since we started doing this. These tools have worked wonders for us, and we feel like we need to share. And you guys have spread the word, and each year this retreat gets bigger and bigger. So thank you for being our community. Thank you for being here today. And I'm going to end with one other slide. Ultimately, we need each other. We need connection, because this is not a solo effort, right? If we want to heal the broken world that we often see on the news, we have to start with ourselves. We have to choose growth. We have to choose freedom. We need to bring peace, health, and wellness into our own lives and pass it on. So really thank you for your attention. Really thank you for your kindness throughout the day and in many other years. And we're happy to take some questions. Maybe Dr. B can come back up.
I am Bandana Chawla. I'm an internal medicine physician, and today I talked about lifestyle medicine, introduction to lifestyle medicine.
Hi, I'm Dr. Munish and I talked about implementing lifestyle medicine. And we really did this event to spread peace, health, and wellness because that's the mission of Peaceful Planet Foundation.
And we want to thank everybody who came out to the retreat today. It made the day so special. Thank you.
So this is, what we do in the community. We try to encourage folks to bring, wellness into their own lives, and we want to spread it. It's done so much wonderful things for us, so we want to share that with all of the community. Really want to thank everyone for coming out. For 7 years, this is the 7th year we've done this retreat, so just want to thank all the volunteers, the presenters, the vendors, everyone involved with getting this retreat up and running.
Thank you.
Thank you.